Greetings from NorCal Services for Deaf and Hard of Hearing. We work with DeafPlus individuals as a way to promote equitable mental health services for DeafPlus individuals. DeafPlus means people who are deaf and have additional disabilities. DeafPlus individuals are no different than the general population in experiencing mental illness. However, effective diagnosis and treatment requires being familiar with deaf culture, communicating effectively with DeafPlus individuals, and understanding the psychosocial experience of being DeafPlus. To professionals who are not familiar with deaf culture, a behavior that is normal in the deaf community may erroneously be seen as psychosis or another mental illness. Psychiatrists who do not know American Sign Language have a higher rate of diagnosing deaf patients with psychosis than psychiatrists who are familiar with it. The deaf community shares a common culture and a common language, American Sign Language, or ASL. ASL is a fully developed language away from English, with its own rules and structure. The language uses movement, space, and facial expressions, which convey tones, voice inflections, and emotions. It can be a challenge for mental health providers to distinguish language-based facial expressions from other nonverbal or non-linguistic behaviors. In our community, eye contact is vital to communication. A person looking away during a conversation in ASL is disrupting communication. For instance, a DeafPlus person will wait until the professional and the ASL interpreter look at them before they start talking. Some physical touch in the deaf community is acceptable. For example, we tap someone on the shoulder to get their attention, and we hug with consent. Deaf-blind people rely on protactile or tactile ASL, which requires touch to communicate. DeafPlus people may approach people outside their circle or strangers, including their mental health providers, the same way they would approach their family and friends. Many deaf individuals experience language deprivation, which results from not having full access to a natural language during the critical period of language acquisition in the first 5 years of life. Deaf babies who are born to deaf parents using ASL have been shown to develop language naturally. But many deaf people are born to hearing families who do not understand that depriving them from sign language can lead to language disfluency. Some characteristics of language deprivation can be confused with symptoms of mental illness in the general population who are not deaf. For instance, they may confuse the past with the present, have difficulty grasping abstract concepts or feelings, and may exhibit poor emotional regulation or coping skills. It's important to always ask the DeafPlus individual their preferred communication method. Writing back and forth and lip reading are never substitutes for communication in ASL. For effective communication, some DeafPlus consumers may require deaf interpreters to be present in addition to ASL interpreters, because deaf interpreters possess native fluency in ASL and are able to facilitate effective communication. Interpreters with DBI certification may be required for deaf-blind individuals. Only use professional interpreters, not family members. Professional interpreters have undergone rigorous training and have professional codes of conduct rules to follow. Interpreters should be positioned next to the professional so the person can see both with ease. even if a caregiver accompanies the DeafPlus person to their appointment. The mental health provider should ask the DeafPlus person directly if they want their caregiver to be present at the session and to communicate. If the caregiver is present, the mental health professional should communicate through the interpreter with the DeafPlus person. Only if the DeafPlus person cannot answer questions, and if permission is given, then the mental health professional can ask the caregiver to fill in the gaps. Understanding how a DeafPlus individual communicates or uses language can help mental health providers to determine if language disfluency is present, and can help identify any support services in their treatment plan. Any treatment plan should consider the DeafPlus person's ability to monitor their medication intake and to explain how they're responding to medication. The treatment plan may need to include an identified support person for the DeafPlus individual. Follow-up appointments should evaluate the DeafPlus person's response to medication in spite of any communication or language difficulties. And care should be given to identifying any side effects or the underlying reason that the person may have stopped taking their medication. In accordance with the California Lanterman Act, DeafPlus adults have the right to refuse medication or treatment. Consult with deaf mental health professionals, deaf service providers in your area, or the deaf specialists at the regional centers. Use caution with evidence-based practices that have not been adapted to the cultural and linguistic needs of deaf and DeafPlus individuals. Request interpreters who have experience and training in interpreting in mental health settings and interpreting for DeafPlus individuals. Ask the DeafPlus person for their preferred communication. Is it ASL, captioning, spoken language, a combination of any two, or all? For example, if they prefer sign language, ask if they have a preferred interpreter they use and understand. Having the same interpreter provides consistency. If the interpreter indicates that they are not understanding the DeafPlus person, it's your responsibility as the service provider to request clarification. You may also ask the interpreter to describe the behaviors and language being used by the DeafPlus person. It's a good idea to provide additional time for your appointments. Communication through interpreters can take more time. You can repeat back to the DeafPlus person what they said through the interpreter to ensure the accuracy of information that was relayed. DeafPlus people benefit from mental health services when given appropriate diagnosis and treatment that considers their individual, cultural, language, and communication needs.